From the perspective of the staff, a hospital is a production facility, whereas from our perspective it is more or less a consumption facility. But it leads to hospitals that from the perspective of the patients are quite, well, they have some negative effects more or less. So something has to be done about it, and something can be done about it. There are some reasons always given to say, well, you cannot do this because, for instance, a hospital is very complex. Well, a hospital is no more complex than any other building. That's a myth. And another myth is that it is a hugely expensive thing to invest money in architecture of hospitals and healthcare facilities in general. It may be expensive, but it is an investment that actually in the long run, and not even that long run, saves money.
More and more people, because we're living longer, are getting cancer. Cancer, like many chronic diseases, has implications for long-term living and for living with cancer, and the implication that a hospital changes from being purely a machine like Charing Cross for curing people to become a more hybrid building. And so the Maggie Center is a hybrid building. It's a house which is not a home, a hospital which is not institutional, a museum which isn't a gallery. It has art in it, and a church, because you have to confront fundamental questions, but it's not denominational, it's not religious. So it's a mixture of at least 4 and probably more building types.
Opportunity to do a Maggie Center was actually deeply attractive at the moment it was offered to me. Attractive to deal with a kind of situation like this. This was the idea, you know, a kind of ring, a ring that would capture that thing here. This is how the thing works, you know, a distribution of living rooms, then kind of more private entities. The open plan section that connects all those private sections, then kind of offers that in a quite natural way has some kind of overview of everything, the final distribution of the program, the way it looks, and I'm sorry I cannot show it to you here, but simply the way each of these elements could have a different atmosphere to create within the house a great degree of variety. We were in a position to test the thing kind of with wheelchairs and all on the roof of a parking lot in our own office, so that we could be sure of our and you know, I've never been so scared to make mistakes as in this case, and so it was a great relief when we could do that.